Hello, and welcome to another episode of the Aligned and Elevated podcast. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Coaching, and happy October. When this comes out, it will be October, funny enough. So, how are you? How are things? This episode is going to be about all things core and pelvic floor, but randomly, I'll just give you a little update. I had a nice busy weekend with the kids' sports, and I did not buy a coffee all weekend long. Did not stop at a coffee shop. And I'm pretty proud of myself. And because normally I'm a multiple times a day kind of person on the weekend. And so this morning I treated myself with my coffee. This is actually a half decaf Americano with sugar-free white mocha, 1 scoop only, and cinnamon powder. I do 1 scoop because the sugar-free still has tons of calories in it. And so, yeah, it is fall, y'all. And how are you feeling? Because I am feeling pretty vibey. My workouts are hitting. My nutrition right now is on point. So let's just hope for another week of it being on point, because you can never, you stay as disciplined as you can be. You try to stay on track. And as far as this goes for me, I've been totally honest and completely transparent. I've definitely struggled with binging. And 2 weekends ago, I was so low energy that I just went all in and had all the food I wanted on Saturday, and actually didn't feel too bad. But it's stopped all progress for at least a week now, because I'm just fighting against that. So yeah, that's where I'm at. If you have 3,800 calories above your baseline calories, essentially, that's 1 pound of body fat. So I probably gained a pound of body fat during that binge, maybe a pound and a half, who knows? So that's not ideal, but it's life, right? And you do what you can. But I'm trying to be locked in on a cut right now and really just get a bit leaner and really push my body. It's been, for me, I love physically balancing my muscles on each side of my spine and really seeing what's happening in my core. And I've been able to see some wild asymmetries in my body. The leaner I get, I can see them when I had extra body fat on me, but now I can really see them, which then helps me further guide my rehab for my body to continue to balance my muscles so that there's equal pull on the spine. So that's what this episode is about. This episode is about your core and your pelvic floor, and how epically important it is to continually be striving to have balance across your spine, across your body. Because if you don't, that's where you end up with this sciatica. That's where you end up with this hip that keeps nagging and nagging and nagging. And then your other knee that starts talking to you. And that's where you end up when you're in your mid 40s and 50s getting those cortisone injections, which then spiral into some replacement of some joint, which then never fixed the problem in the first place. So then you just go start wearing out the other joints. We need balance across the pelvis, balance across the spine, and we need a really strong and healthy deep core, and we need a dynamic and mobile diaphragm and pelvic floor. So when I say the pelvic floor needs to be strong, I'm essentially saying that it needs a shit ton of range of motion so it can totally expand and it can contract. So it overstretches and it can recoil. That's the dynamic movement that the pelvic floor has to have, and it's not that complicated, but people have a really hard time gaining that control. And when you see this bullshit about sitting on different Emsella chairs or different products to help get you the Kegel and get you the contraction, that's never the problem. Even the people that I can't get to contract, it's 100% because they don't have any neurologic connection to any movement that's happening in the pelvic floor. So they get tightened up into this little ball of the pelvic floor that doesn't move, and so therefore can't stretch to get the contraction. If you cannot get the relaxation, you cannot get an adequate contraction. End of story, game over. I'm super freaking passionate about it because all the marketing that I see right now about people getting their pelvic floor stronger is just so false. It's so far from the truth. And people want to just make quick money by getting you to sit on a chair and squeeze your pelvic floor. That's just not okay. It really makes me angry. The reality is we need the overstretch. And then you can, train your pelvic floor. But also, Your diaphragm is equally as important as your pelvic floor, and we don't lift weights for our diaphragms, okay? Our diaphragm sits underneath our lungs. So it is every time you inhale and you take a really deep breath in your lungs, you inflate your lungs, your diaphragm is elongating and stretching. It is not contracting. When you exhale is when you get the recoil and contraction. So when you inhale all the air into your lungs and make your belly super big, make your ribcage super big, lungs fully inflated, the diaphragm is at its maximum stretch. What happens is that the pelvic floor has to mirror that exact same movement. So when you are at maximum inflation of your lungs, maximum stretch of the diaphragm, the pelvic floor needs to be maximally opened and stretched. And then as you exhale, you get the recoil. Now, side note, if you're training for childbirth, you should actually try to train keeping the pelvic floor nice and open and stretched while you exhale. That is a whole nother level of coordination, but if you can get that, you will have a much easier delivery. So now you want to ask me, how do people get this kind of stretch in the pelvic floor? You have to train it. You have to cognitively train it. Everybody should be at least breathing like this 5 minutes a day. This type of breathing is called diaphragmatic breathing with pelvic floor opening. And this type of breathing keeps you in a parasympathetic, rest and digest, relaxed state. It helps stimulate the vagus nerve, which is part of the parasympathetic system, keeping us relaxed, keeping our bodies in homeostasis, keeping our bowels more regulated when we spend more time in parasympathetic states of the nervous system. In this day and age, when we're scrolling social media and we're just like hopping to one thing after another, we filled our lives with so many things to do and places to be and all these people to take care of. When we have that kind of lifestyle, we are rocking in the sympathetic nervous system. We are ready to go. We are shallow breathing most of the day. So we aren't getting these nice, lavish, deep breaths where we stimulate our opening of our pelvic floor, stimulate the opening of our diaphragm. So then we end up in this hyper state, and any hyper state of the nervous system is going to cause more upregulation of the pelvic floor, increasing the tension of the pelvic floor, increasing the tightness of the pelvic floor, therefore decreasing its ability to function. If you have increase in tightness of the pelvic floor, your pelvic organs can sneak below the line of the pelvic floor and therefore cause prolapse. It can cause urinary incontinence. It can cause urinary urgency, making you feel like you have to go pee all the time. And urinary incontinence is where you're peeing or like actually peeing yourself, losing some urine. And so those are not normal, but they happen. They're so freaking common because no one has this ability to really open and dynamically control their pelvic floor. And so then when we're training people to do a Kegel, it's so freaking irrelevant. And let me tell you more reasons why women have tightened, elevated pelvic floors that don't freaking work for them. And therefore they have really weak cores. And by the way, a strong core is not a washboard six-pack ab. A strong core is being able to relax your belly, have a soft belly, and being able to distend your diaphragm and your pelvic floor so they're open, massively open, and then they naturally recoil. It's not something you actually really have to train. If you keep your glutes strong and you keep your lower transverse abdominis strong, then you end up with a super solid core. You need to also knit into that equation the lower traps and the lats, and you will end up with this really nice dynamic core. And so when that isn't happening and we have dysfunction and we have tightness in that pelvic floor, we end up with all these other issues. And so it is just so important. And one of the best ways to get dynamic excursion of the pelvic floor, meaning massive opening of the pelvic floor, which is going to help your strength, which is going to help your sex life, which is going to help improve the quality of the vagina, the actual pelvic floor muscles. You're going to have better self-lubrication if you can get that excursion and opening of the pelvic floor, because you will have more blood flow. Therefore, those muscles will be healthier. If you get that excursion and you get the more blood flow and you have that nutrition going to these muscles end up feeling like a nice juicy chicken breast instead of like a dehydrated beef jerky. That's what is not healthy. And when you have beef jerky, it can't move that well, and therefore sex doesn't also feel that good, and it's harder to get an orgasm because it just is kind of stuck in that hyper contracted state all the time. But I digress. The other things that cause that really heightened elevated pelvic floor can be chronic stress. It can be any trauma. So things that have happened to us that we haven't fully processed. They might not even be fully conscious in our brains, but we are constantly guarded because of our traumas. These could be macro traumas where someone died when we were young, or we had problems in our childhood, or they could be micro traumas when you remember being yelled at for this thing that you didn't even do, and you took it and you have guilt and shame around certain things. And so it doesn't matter if it's a micro trauma or a macro trauma. We all got traumas, and if we aren't processing those and healing our bodies, then that gets stuck. If we don't process the mental traumas, then we're getting stuck in our pelvic floor with this tightened, elevated response, because it is so tied. The pelvic floor is so tied to our emotional regulation, our ability to emotionally progress and process our emotions. And so the pelvic floor is your entire body. It is how the mind is connected to the soul. It is how the emotions are connected to the heart. It is how we store everything. So, yes, pelvic floor physical therapy, and also integrating and healing the rest of your body. And when you start to work through the pelvic floor, you realize that you can process so much more. And that's where you can get this more like spiritual awakening, or kind of dive on this new path of improvement, self-improvement and self-growth. And that all came from me talking about how to get a strong core. I didn't even mean to go there, but I'm just telling you the little bonus parts that you're going to get when you start to work on the dynamic extensibility of your pelvic floor, because they are so epically important in your ability to function, as far as from a musculoskeletal standpoint, keeping your joints strong, keeping your body fully healthy, but also in the fact that it will spiritually keep you more alive and keep you healthy and keep you evolving. So this is the Aligned and Elevated podcast for a reason, right? And getting there from starting on this physical level, this very physical level, where you learn to control your core, your deep, deep core, with inhaling and opening the pelvic floor, and being able to exhale and allow that recoil to happen. When you can start to control those and get very good mobility in those areas, then you have you are catapulting yourself into having very strong core and muscle connections, and your body is going to feel really good, and you will start to elevate. You will start to find those self-growth periods. And so I'm just telling you this because the core is just so vastly important. So what people need a lot of times in order to get full range of motion of that core, and I fully believe that I'm tuned up, but I need this at least once a month to help regulate me. Because when I am training so hard, I'm lifting 4 to 5 days a week. I run a business. I run my household. I have 3 children. We are go, go, go. And I wouldn't have it any other way. I love this absolutely to the core, literally. But if I am not getting constant pelvic floor work done, where I am at least once a month getting my pelvic floor to open and expand in even further directions that I have control to bring it to, therefore someone else is doing the work for me, literally putting their finger inside my vagina with a glove on, mapping out every single muscle, dynamically moving my hips at the same time that they're stretching muscles, getting me completely new range of motions. This is how you get a strong pelvic floor, y'all. This is the magic to getting a strong pelvic floor. It is not busting out Kegels. It is not busting out going to sit on a chair that does this work for you. It is getting someone to really work these muscles. Now, can you do this work with a wand? Semi. You will never be able to stretch and get the angles you need to in order to fully get the magic of full extensibility of the pelvic floor, but it will get a little bit of the job done. It's like trying to give yourself a massage. You just can never really do it as well as someone else can do it. So that's where that comes into play. I want to tell you that sure, go get a wand and it'll save your life, but that's not the case. So the best thing you can do is finding a pelvic floor physical therapist who actually gets what I'm saying and spends the time to dynamically bust out new range of motions of the pelvic floor, giving you this dynamic extensibility so you have a super strong core. That is the magic. So now you have this, and this is what I do. I once a month get my core worked on like this, and then I'm training my movements in the gym and outside of the gym, whether I'm unloading the dishwasher or folding clothes. I'm training my body to activate and drive movement with my lower transverse abdominis muscle. So that's the muscle that when it's contracted appropriately, you're going to feel a firming under your fingers and an elevation of this muscle. And if you can get that muscle to activate as you do dynamic movement, and then as you do anything with exertion, you're exhaling So you're getting some elevation of the pelvic floor. Your diaphragm is elevating. You're decreasing your intra-abdominal pressure. You're going to save your pelvic organs. And that's how you can really knit up a nice tight core. Now, then you integrate driving the movement with your lower transverse abdominis muscle, your glute maximus, glute medius, and glute minimus, and you have a powerhouse of a core. Because if you can get glutes to also drive your movement, that is going to inhibit the pelvic floor from driving your movement. And Lord knows we don't need the pelvic floor driving anything, because the pelvic floor is already prone to upregulation when you have a highly contracted or a highly sympathetic, stressful life, okay? So we don't need the pelvic floor driving any of our movement. We need our glutes driving the movement. We need the lower transverse abdominis driving the movement. And then you integrate those. So again, let me repeat this. When you have good, solid foundation of glute movement and glute activation, that helps decrease the stresses in the pelvic floor. Then the pelvic floor can sit in a more relaxed state. If the glutes are super weak and you don't have hip extension and you don't know how to activate your glutes or use your glutes, all the more reason your pelvic floor is just going to be overworked to the nines, way too upregulated, because then the pelvic floor is going to be trying to do all the work of the glutes. Same thing with the hip flexors. If the glutes are weak, you don't have extension of the glutes, you don't have hip abduction, and you're lacking some internal rotation, and you can't activate your glutes functionally during your movement, during walking, during standing, anything like that. If your glutes are just flaccid and not working, and or you're constantly squeezing your butt, that's not good, because then you can't use those muscles functionally, and your pelvic floor is going to try to do all the work, again, causing that shortening of the pelvic floor. So we got to get the glutes to work in order to save the pelvic floor. So once we get the glutes going and we can connect that with the lower transverse abdominis muscle, then we start to integrate the lower trapezius muscle and the lats. When we can get the lats and the lower trapezius muscle to integrate with the glutes and the lower transverse abdominis muscle, that is what we need to have a super solid, strong core. Now, sure, we can get the obliques to work. We can get the rectus abdominis, the six-pack abs to work. But the reality is, like, those continually drive movement without us having to really consciously do it. Most people I see have over dominant obliques because they don't have good control of that lower transverse abdominis muscle. So once you start to get that lower control back, and also, by the way, radial pressure shockwave is absolutely incredible for getting that to lower transverse abdominis muscle to repattern. It also creates this incredible skin firming and tightening effect of the muscle, allowing you to start to connect to it better and retrain it better. So highly recommend that treatment. But I digress. I need to finish this podcast quickly because I have a patient. But when you can get all those firing and working together, you are going to save your pelvic floor, and you're actually going to have a really strong and healthy dynamic core. That is the secret, you guys. This is all that has to happen. So then say this happens, and this is what's happening in my body. This is what I'm constantly striving for. But I have these old movement patterns. I have this bum knee. It's not a bum knee. I love you, knee. I love you. I love you. I love you. But I have an old knee surgery, and I don't have full proprioception on this knee, meaning when I balance in space or when I move this knee, like, I just don't fully utilize my entirety of the joint. So my arthrokinematics are a little wonky on this side. So the joint doesn't move as naturally as it should because it's been cut open. So it'll probably never move naturally again. That's the consequence of surgery. And so this is now my lifelong battle of trying to prevent any other surgeries because of this stupid, unnecessary meniscectomy that I had on my left knee that I should have never, ever had. I should have listened to every single physical therapy professor that was smarter than me telling me not to get it done. I did not listen. So here I am for the rest of my life trying to retrain my body and equal my patterns, because now what happens is that this knee is just not strong enough. So I play hockey, right? So my right leg takes over for my left leg. When I'm skating or in the heat of the moment, it's so hard for me to shift and recruit my left side as well as my right side. I'm just more stable on my right side. So I can cut harder. I can play harder on my right side. I can kick myself into gear harder on my right side. This isn't conscious. This is all subconscious. So retraining this is extremely challenging. It has been my battle. And so I'm not saying that you guys play hockey and that's the thing, but we all have our things, whether it's hiking, walking, running. We all go into these compensatory changes and patterns. So that is what I'm working working towards. So my right glute doesn't kick as well because I bear so much weight on my right side. It gets overused. My obliques on my right pull harder. My right psoas pulls harder, so then it's pulling on my spine. And this is what's continually causing me my disc herniation. So when I'm herniating my disc, giving myself a disc herniation, this is the pattern that's doing it. It's all stemming from this. So I have to work really hard at keeping this balance and really working on recruiting the right glute to take more load, because my right hamstring tries to overcompensate for my right glute, and so does my right tensor fasciae lata. So this creates a little bit of sciatic pain on my right and predisposes me to a disc herniation. So this is kind of my pattern. I'm explaining this because it is so epically important that we constantly train our bodies to have symmetry across the spine, across the pelvis. And as we develop that symmetry and maintain and regulate that symmetry and just constantly working towards getting that symmetry so we have those equal pulls, that's how we're going to save our joints with the activation of our deepest core and having a really strong core. Now, I would say a lot of people come to pelvic floor physical therapy and they only ever get the control of their core and they don't get the balance piece. And so that's really where it's like you have to be on maintenance. You have to be doing maintenance work. Like you can't just go to PT and get it done and then be cured. Like we all have patterns that have been with us for years and years and years, and we have to fight those patterns. And so having someone look at your body and really analyze what's happening in your skeleton is what can help prevent these patterns and these breakdowns in the future, causing you joint replacements, causing you diapers, causing you bladder surgeries, causing you injections, causing you years of sciatic pain. That's where I've got for you today. I hope you enjoyed this episode. I'm Dr. Allison Feldt. If you are looking for these type of results and you want someone to break down your movement pattern, make an appointment in my clinic. We're bodymotionpt.com. People fly from all over to come visit us. That's like as simple as that. So I hope you enjoyed this episode. Please like, subscribe, send it to all your mom friends. We all have these patterns that we're working against. And I hate hearing that people were prescribed Kegels and no one was working on their extensibility of their pelvic floor. I hope you have a lovely rest of your fall day.